I'm really excited to show you this new device. It's called HFT 150 by Invent Medical. It's high flow therapy. And as I go through the unit, I really want you to notice a few aspects, primarily the ease of use and how everything is integrated into the unit itself, as well as how the unit's mobile and ready for transport. So your patients can get up out of bed and get moving. This unit is exciting because of just its ease of use and how everything's incorporated. The way that we do high flow oxygen at our hospital. Currently there's a lot of moving parts, and we actually have a different equipment tech that has to come and put everything back together after cleaning and processing. With this, everything comes in a kit. We can turn this thing around and clean it at the bedside, but almost even more importantly is the usability of the interface. Little or no training really would be required for someone to walk up and then take a look at the screen, see what's going on, and make simple adjustments even, which I think is critical for a device like this and nursing. Okay, let's look at the front of the device here. I want you to notice a very modern color, high resolution screen here. It's a touch screen, and all of the settings are on the front of the panel on the touch screen, easily accessed, starting with temperature here. And when we select any of these settings, it's very intuitive. You touch it and then you adjust it with the knob by turning the knob, and then you can touch the screen again. As we move on, let's look here. We have the flow. So if we want to set the flow and the liters per minute, we can again touch it and scroll. And if we wanted to, the other way to do it would be to depress the button. This is very intuitive, easy to use. And then next, as we come across, we have FiO2, fraction inspired oxygen percent. Again, you would just touch it to highlight it, turn, and either push the button to confirm or touch that aspect of the screen again. I'd like you to notice here we have the alarm silence in the top right, and that will give you 2 minutes of alarm silence. There's a settings screen that's also very simple, and you would access it in the bottom left here. And you have a few different options of things to set: the date and time at the top, the nurse call configuration, which we'll talk about in a minute, patient type. You can go adult or pediatric and set defaults for that. The screen blank time, how many seconds elapse before the screen goes dark if the patient doesn't want the screen shining in the room at night. And then again, over to the right of that, LCD brightness, so the actual light output of the screen itself. And then you can also set the pulse ox alarm limits when you access the menu button to the left here. And it's the high SpO2, low SpO2, as well as heart rate. Now let's look at the back of the unit. We have the air mixer that's incorporated within the unit itself, and the high pressure gas outlet connection. We have the SAP probe connection, which is a Nonin pulse ox that's incorporated in the unit itself. And here's the probe, and it fits in right here. We have a remote alarm just below that for the nurse call alarm. And then over in the bottom right corner, we have the power, and it comes with a power pack like this. And then, of course, the on-off switch. The other aspects of the disposable kit are the tubing and interface, of course, but first I want to show you the filter here. This is a HEPA filter. It's disposable, and it's to be changed between each patient use. And the kit comes with a tool, and the tool is made to make it very easy for the HEPA filter to come out. It just twists out. The old one is removed and the new one is put in place. The tubing itself fits into the outlet like this, and clicks into place. And as you can see, there's no probes, sensor probes, or wires or anything. It's all integrated within the circuit itself. So I think you can sense my own excitement about this unit, not only for the patients and it's the ease of use and comfort, and also how easy it is to get mobile with the patients, but also the respiratory therapist and how easy it is to clean the unit, turn it around with the disposables kit, and keep moving.